There are plenty of benefits to living in the Midwest, but experts say there's also a hidden risk. It's called the aneurysm beltway, and people who live in it face a greater risk of dying from aortic disease than anywhere else in the country. Teresa Snow shows us how doctors in Missouri are working to change that.
They look like a balloon bulging in the aorta, the main artery that carries oxygen-rich blood to the body. They're called aneurysms, and if they burst, they're usually fatal. Jack Bell was lucky to survive.
It's called the silent killer. You could have one right now and you wouldn't know it until it ruptured.
Probably treat 1 or 2 of these cases a month.
Dr. Jonathan Bath's accent gives him away as an Englishman by birth, but he chose to come to Columbia, Missouri, and University of Missouri Healthcare.
This is one of the highest prevalent areas in the country. Informally, we have this idea of what we call the aneurysm belt, essentially, which runs through the Midwest, and it's just a clustering of these risk factors.
Caucasian men over 50 are at the greatest risk. Other risk factors include diabetes, smoking, and family history. But combine these risk factors with living in rural areas and more than an hour away from a doctor, you have a deadly scenario. Both Jack's mother and grandmother died of ruptured aneurysms, putting him at high risk. Bell was lucky to find the problem with a free screening.
One area we can really improve, I think, is in screening, making sure that people understand that this can happen to anybody. You know, your father, your brother, somebody you care for.
And it's easy. A simple, painless ultrasound can catch a deadly disease before it's too late.
This is an area of weakened aorta that's ready to rupture.
For Jack, doctors were able to locate and repair several aneurysms before a rupture.
I feel fine, really. I do. I feel fine. I pretty well do whatever I want.
Dr. Bath recommends men be screened around the age of 65 as part of their routine physical. If an aneurysm is detected, doctors will monitor it regularly. The FDA issuing its strongest warning for a popular asthma and allergy drug. The agency issuing a boxed warning for Montelukast, sold under the brand name Singulair. The new label will tell doctors to avoid prescribing it for mild symptoms, especially for those with hay fever. Singulair has carried a warning since 2008 about a link with an increased risk of depression, suicidal thoughts, and sleep problems. However, the FDA now says the risks may outweigh the benefits in some patients.